To reduce the risk of developing dementia, one must adopt a comprehensive, evidence based approach that targets the key biological and environmental contributors to cognitive decline. Dementia is not the result of a single factor, but arises from the complex interplay of genetics, vascular health, neuroinflammation, and lifestyle behaviors over decades. First, maintaining optimal cardiovascular health is essential. Research consistently shows that midlife hypertension, diabetes, and high cholesterol are strongly associated with later life cognitive impairment. Second, regular physical activity is one of the most effective interventions. Aerobic exercise enhances brain-derived neurotrophic factor, promotes hippocampal neurogenesis, and improves vascular function in the brain. Aim for at least 150 minutes per week of moderate intensity aerobic activity, and include resistance training 2 to 3 times per week to maintain muscle mass, improve insulin sensitivity, and support overall neuroplasticity. Third, diet plays a significant neuroprotective role. The Mediterranean and Mind diets, rich in polyphenols, adequate intake of B vitamins, especially B12, folate, and B6, is critical to prevent homocysteine accumulation, which is neurotoxic. Cognitive reserve is another protective factor. Individuals who engage in intellectually stimulating activities across their lifespan tend to exhibit a delayed onset of clinical dementia symptoms, despite the presence of underlying pathology. Reading, learning new languages, solving complex problems, and maintaining robust social engagement all contribute to cognitive resilience. Chronic inflammation and oxidative stress are central drivers of neurodegeneration. Maintaining a healthy weight, especially by reducing visceral adiposity, helps lower systemic inflammatory markers such as C-reactive protein and interleukin 6. Anti-inflammatory dietary strategies, physical activity, and mindfulness-based interventions can modulate the immune system and protect neuronal function. Hearing loss, often overlooked, is a modifiable risk factor. Emerging evidence links untreated hearing impairment to social withdrawal. Early cognitive screening, particularly in those with family history or subjective concerns, can help identify at-risk individuals and allow for earlier intervention. In conclusion, dementia prevention requires a systems-level approach that integrates cardiovascular optimization, physical fitness, targeted nutrition, mental stimulation, restorative sleep, inflammation control, sensory health, and psychosocial well-being. The earlier these strategies are implemented, preferably in midlife, the greater the neuroprotective benefit. Effective management through therapy, medication, and social support is necessary not only for emotional well-being, but also for cognitive longevity. Exposure to neurotoxins such as heavy metals and certain industrial chemicals may contribute to neurodegenerative processes. Reducing contact with these substances, whether through occupational protection, dietary choices, or environmental awareness, is another preventive measure. Finally, genetic risk factors like the APOE4 allele do influence susceptibility, but they are not death.